This is the part where you've just come from a high school. You're probably the best in your region. Some people, actually, the district sends the person to come and represent them at medical school. So you have like an entire district. All your ancestors are praying for you. They actually host parties. Some even cut goats and they send you. You're like the best in the region, but they don't tell you that you're coming to a pool that is going to dilute your knowledge, because everyone is literally the best in their region. You don't know that yet. You think you're the best of the best, but the realization that you get when you reach, there's actually not so much going on in year one. It's just everything is in introduction phases. They're introducing you to everything, but they don't tell you what is coming next. Now the thing with year two is that if you do not drop out in this stage in medical school, you're on your way to making a very good doctor, because there's a very strong shift from being a fresher to being a year two student. They pump you with content to the point where you're like, I'm tired, but you have to keep going. You have to keep going. Like if there's a new drug that was invented yesterday, you will study about it. If there's a new disease that came up yesterday, you will study about it. Like everything that these people, I can't even explain it, because the year two students are the ones that have no life. Like, it's the worst place to be in medical school. Like you have to understand over 1,000 drugs, but I don't understand. Like these drugs take people years to discover and understand how they work. But for you, you're supposed to get them in those, like, is it 6-8 months of the whole year? Like 1,000 diseases, like all the pathologies that have ever existed, all the viruses, all the bacteria, all the like everything you're supposed to get it in that year, because they're preparing you for your clinical years. So it's like the last stage of the biomedical years, and it's the worst stage to be in medical school, the very worst stage. If a year two student calls you and asks you for money, just send them. If they call you and they want a hug, you go there and you hug them, because they're going through a lot. Now, when you cross over to year three, this is the part where actually most people start realizing that they're doctors. Like, you call your parents, you're like, okay, send me, I need a stethoscope. They're like, what is that? You put ears and then you listen to it, they send it over. Most of the time, you don't know what to use it for, but you call for it and they give it to you. So you have a stethoscope, you have a tendon hammer, but you don't know which reflexes to check for. But you have the material, you have everything necessary. Like, this is the part where you rotate around all disciplines. It is a transition, a very big transition, because they were pumping you with information from year two, but then you come to year three and you can't make sense of any of that information, because you're on word rounds and people are discussing things and you're like, this is interesting. This is the part where they ask you very easy questions on a word round, like, a patient has fever. What do you think they have? And you're like, you can't answer. You can't even think of malaria in that state. That's how bad it is. Like, when your friends call you to ask you where you are, this is the part where you tell them, I'm in theater. We are doing a whippos. I say, what do you mean you're doing a whippos? You're not doing a whippos. Actually, in theaters, the dustbin is more important than you. The only reason you're in theater is so that they can ask you a few anatomy questions and you fail them and you go back and relay. That is the entire year three. Like, you rotate around all these disciplines, it makes sense. You go to OBG, women are crying, you also want to cry with them, because, okay, they see you in a clinical court and they think you can help them, but they don't know you're here for help as well. Year three is a very funny, and it's a very bad place and a good place to be in, because on word, everyone feels pity for you. They're like, oh, Bambi is a baby, he doesn't know anything. So they can't fire you very big questions. But the patients don't know that. So they keep consulting you. Like, the patient could bring a treatment chart and they ask you, Musao, so doctor wrote for me this medicine. He told me to take this one. I don't know. And you don't even know what TDS is. Like, it is very embarrassing to be in year three, because year three is a very humbling experience. Like, you don't know anything, so you're always available when they need someone to send. Like, if a sister wants someone to send to go and bring a cannula, you're there, because you just want to learn how to cannulate. If a patient wants to talk to the doctor, you're there to be sent, because you want the patient to help you listen to their heart maybe later. Like, it's a very humbling experience. They don't expect much from you, but you just realize that, okay, you do not know any medicine. Yeah. Like, these big doctors will make their word rounds and they write in the files, and then they leave the files there for you, of course, to look through, and you look through things and you're like, wow, people have actually read books. And you look at the medication bit and someone not, let's say drug like IV suffixing start, and then you sit there wondering, what does start mean? Does it mean they start their medicine today? They start tomorrow? And you cannot ask around, because you think you're the only one who doesn't know. It is a very humbling experience to be in year three. It just shows you that there are levels to these things. Now, year four is a part where you get a break from all of this stress. Like, you're doing specials. There's not so much going on. Like, it's people who chose to do specials. didn't want to do the big four. So like, there's nothing much you can help with them because they are specials. So, like if you go to dermatology, people are diagnosing conditions, 5 different conditions. They're giving everyone the same drug. So like, it's, like everyone at Optha is with eyes. So like you're out of the place. Ask you which class are you? Yeah, they're like, oh, okay, interesting. Like no one cares about you. No one wants to know. Like year fours are just in the middle there. Like year threes are junior clerks. Year fives are senior clerks. Like year fours, there's no name for you. You're in medical school, but this is the part you can actually get married if you're serious about it. You can start a relationship and you can thrive for at least that year. You can do many things. You can start a business and it also thrives. It's a part where you sit down and reflect and you look back to your life and the bad decisions you made and why you made them and how you got into this place in the first place. Like if you do not enjoy medical school in that year, you might never enjoy it because what comes next? Now, year 5 is where everything is supposed to make sense because the year 1s, year 2s, they see you as their senior. They don't even see you, they just hear about you because you're never with them. The year 3s see you as their senior. When you're on ward rounds with year 3s, every question they have, they will come to you before they go to the seniors. The intern doctors see you as their colleague because they were year 5s last year, so they're also seeing you as a colleague. The senior house officers, they see you as a senior too. The doctors or the specialists, they expect you to know everything. Like, you cannot not know. It is unacceptable. You see, like in year 3, where they could ask you questions, and you're like, doctor, I think I'll go back and read, and they allow that. This time it's unacceptable because if they ask you a question, you should answer. Or else they're like, we cannot release a half-cooked doctor into the system. No, we shall have to retain you. Like it's a very political but interesting year to be in. Like if you're very serious in your year 3 and you read your Hutchison and whatever, this part you know most of the things. Okay, not everything, but you're good. You're basic good. Like if someone hands you an AKG and you're very serious, you can read an AKG and everyone you read it to your colleagues and people are like, yeah, content, I guess content. You're like, you completed Hutchison's. Like this is the year where you get the X-rays because they're too easy. You give them to the year. You look for a random year 3 and you give it to them and you're like, read this for me. And you see someone suffering, sweating, and deep down you're laughing. Then you pick it from there, like, come and I teach you. You know about ABCD?